golf player, complaints of pain on the right elbow for the past 2 to 3 weeks. Examine the patient, examine the elbow joint, and talk to the patient. This is my example. This is my GMC number. Understood my task. Shall I proceed? Hello, Mr. Vishal. I'm Dr. Mohan, one of the doctors in this department. I'm here to examine your elbow. I hear that you are injured your elbow. Is that right? I'm really sorry about it. For the purpose of examination, you need to undress above the waist, and I'll ensure adequate privacy and ask my examiner to kindly be the sharp. Is that okay? Can you please stand up with your outstretched hands like this? Thank you. Both the shoulders, both the elbow, both the wrist joint are symmetrical. I could appreciate increased carrying angle on the right side. I couldn't appreciate any verbalizing my finding to the examiner. Just kindly bear with me, okay? I couldn't appreciate any redness, any swelling, any bony deformity or muscle wasting on the anterior aspect of the right elbow. The cubital fossa is free. I couldn't appreciate any swelling. Now I'll be going behind you, Mr. Vishal. Okay. I couldn't appreciate any redness, any swelling, any bony deformity or muscle wasting. The olecranon fossa seems to be normal. Okay. Now I'll be touching you for the purpose of examination. Just let me know if there is any discomfort. Okay. Ideally, I should have started my examination from the left elbow, but due to time constraint, I'm examining the right elbow joint. I couldn't appreciate any localized rise in temperature. Now I'll be touching it quickly. Just bear with me. Okay? I'm really sorry about that, Mr. Vishal. Are you alright? Yes. Do you need any painkillers? Shall I proceed? I could appreciate tenderness on the medial aspect of the right elbow in my patient. Now I'll be asking you to do some movements. Is that okay? Yes, before that, I should look for the radial head. Could you please bend your elbow? Now I'll be twisting your elbow joint. Is that okay? I could appreciate the radial head. There are no crepitations. Thank you, Mr. Vishal. Now I'll be going behind you. Could you please bend your both of the elbows? Could you please extend it? The 3-point system is maintained in my patient, the medial epicondyle, lateral epicondyle, and the olecranon process. Now I'll be asking you to perform some movements. Is that okay? Could you please bend your elbow joint like this? Thank you. Could you please extend it? Both the flexion and extension seems to be normal in my patient. Could you please tuck your elbow joint in your tummy and then move your palm inwards like this? Okay. Pronation is limited in my patient. Could you please make your palm upwards like this? Supination is normal in my patient. Okay. Now I'll be doing some special tests in you, Mr. Vishal. Just tell me if there is any discomfort at any point. Okay. Could you please bend your elbow? Thank you. Could you please make a fist? Try this is my movement. Okay. Okay. Could you please show your palm? I'll be gently moving it downwards. Is that okay? Okay. I'm really sorry about that. Are you okay? Okay. Cousins and Mills test is positive on supination. Could you please bend your palm? Could you please turn your palm inwards? Could you please make a fist again? Try resisting my movement. Could you please open your hands? I'll be gently moving it downwards, okay? Thank you, Mr. Vishal. Cousins and Mills test is negative on pronation. Now I'll be looking for your pulse. Is that okay? I could appreciate the radial artery. Could you please wiggle your fingers? Thank you. Thank you, Mr. Vishal. You have been very cooperative. Now I'll be talking to my examiner. You can now dress up. Okay. Ideally, I will complete my examination by examining the joint above and joint below. My most probable diagnosis is medial epicondylitis, since patient is having the Cousins and Mills test is positive on supination. Thank the examiner.
Your task was talk to the patient.
Talk. Okay. I forgot the task. Okay. Mr. Vishal, from what I have examined you, you are having a condition called as medial epicondylitis. Do you know anything about it? Okay. Don't alarm by the name. It is just the inflammation of one of your bony prominences in your elbow. Okay. Do you know anything about the management? You want me to explain? Initially, we'll give you some painkillers and also give you some sling, and also first of all we'll do to rule out bony injury, and then we'll give you some sling in order to rest your elbow joint, and then we'll be giving you some painkillers for 2 to 3 weeks. And after that, we'll decide upon the for further management.
Will I be fine for 3 weeks of that?
Most probably this condition will involve only up to 2 to 3 weeks. Most of the patient will recover in 2 to 3 weeks, but sometimes patient might have pain. I'm really sorry to say this. Sometimes patient might have pain for after 2 to 3 weeks, but there are some other management for that. My consultant will decide upon injecting some medicine called as steroid, and he will decide upon the further management as well.
Okay.
If it is not subsiding, but hopefully it should. Okay. Do you have any other concerns? Fine.